Good afternoon. Our project focuses on the whooping cough, medically known as pertussis. You may have heard of it or referred to as the 100-day cough because of how long the symptoms can last. Today, we'll be covering what causes it, the characteristic symptoms, the most effective ways to prevent it, and its overall impact on public health. Our names are Madigan and Jocelyn. So, what is a whooping cough? A whooping cough is a highly contagious, acute respiratory tract infection. It mainly affects people of all ages, but is especially dangerous in infants. The cause is a specific type of bacteria called Botella pertussis. The bacteria attach to the cilia that line the upper respiratory system and releases toxins that damage the airways. It spreads very easily through the air when an infected person coughs or sneezes. It's so contagious that up to 80% of non-immune people exposed will contract it. The name whooping cough comes from a distinctive sound a person makes when they gasp for air after a severe coughing fit. This slide contains of the symptoms and stages. A whooping cough symptoms unfolds in a predictable 3-stage progression that can last for many weeks. The first stage, the catarrhal stage, lasts 1 to 2 weeks and is often mistaken for a common cold. You'll see a runny nose, sneezing, a low-grade fever, and a mild occasional cough. Fortunately, this is the stage where the disease is most infectious. Next is the paroxysmal stage, where the cough becomes severe and uncontrollable. This stage can last 1 to 6 weeks, and sometimes even longer. The hallmark system is the rapid, successive coughing fits, followed by the high-pitched whoop sound as the person inhales. The coughing can be so violent it causes vomiting, exhaustion, or even broken ribs in adults. In infants, the whoop may be absent. Instead, they may have episodes of stopped breathing called apnea. The final stage is the convalescent stage. This is the gradual recovery phase where the coughing fit slowly becomes less frequent. However, the cough may persist for weeks or even months as the lungs need to heal. Complications and who's at risk. While most older children and adults recover without major issues, whooping cough can lead to serious complications, especially in specific groups. Infants under 1 year old are the most vulnerable. About half of babies who get whooping cough need to be hospitalized. The most common and serious complications in infants include pneumonia, slowed or stopped breathing, seizures, and in rare cases, brain damage or death. For older individuals, complications are usually caused by the physical strain of the coughing fits, leading to things like cracked ribs, hernias, or broken blood vessels in the eyes. Anyone whose immunity has worn off is at risk, including adolescents and adults who have not received a booster vaccine.
The best way to prevent whooping cough is through vaccination. There are 2 main vaccines, DTaP for children and Tdap for adolescents and adults. The P stands for pertussis and is combined with vaccines for diphtheria and tetanus. The Tdap vaccine is given in a series of 5 shots to children. The Tdap booster is recommended for preteens around age 11 or 12, and then as a single dose for all adults who haven't received it before. It is highly recommended that pregnant women receive the Tdap vaccine during the 3rd trimester of every pregnancy. This passes protective antibodies to the newborn, offering them a short-term protection until they are old enough for the first dose. This strategy is critical because infants are the most vulnerable. If a person is diagnosed with whooping cough, treatment is primarily with antibiotics such as erythromycin or azithromycin. Antibiotics are most effective if given early during the catarrhal stage to help lessen the severity of the cough. However, even if started late, antibiotics are important because they can quickly stop the person from being contagious, which is usually after 5 full days of treatment. Cases of whooping cough have actually been on the rise globally in recent decades. The reasons include waning immunity from vaccine over time and some decline in overall vaccination rates. It remains a significant public health concern with an estimated 24 million cases worldwide annually. In summary, whooping cough is a highly contagious bacterial respiratory infection with a characteristic whoop cough, especially dangerous for infants. Vaccination is the cornerstone of prevention. We all have a role to play in protecting the most vulnerable, particularly newborns, by ensuring our own vaccinations are up to date. Here are the sources and websites used for this presentation. Thank you for listening. Our emails are listed below for any questions.